A newly published study examining side effects associated with Librela, link in the description. Also known as bedinvetmab, an injectable medication commonly used to manage arthritis pain in dogs. For many patients, the results are an impressive illusion. Dogs often become more comfortable, more mobile, and noticeably happier. But alongside these benefits, the paper highlights a small number of cases where more serious joint changes have been observed. What's encouraging and what's concerning? Librela works by targeting nerve growth factor, a key component in how pain signals are transmitted. By interrupting this pathway, the drug can significantly reduce discomfort. The issue raised in this paper is not about common side effects. It's about rare and potentially severe joint deterioration that appears after treatment in certain dogs. How I interpret these findings as speeding up underlying joint disease. In some cases, that progression becomes so rapid and pronounced that it's clearly visible on imaging. So the condition itself isn't new, the pace at which it develops is. Two patterns emerging. The study outlines two main types of joint changes. 1. Rapid joint degeneration. In these cases, the joint structure breaks down far more quickly than expected, with accelerated loss of cartilage and bone integrity. 2. Gradual but abnormal bone formation here. Changes occur more slowly, with excess bone developing around the joint. Because pain is reduced, these changes can go unnoticed for longer. Why could this be happening? There isn't a single confirmed explanation, but several factors likely contribute. Dogs feel better, so they move more and place greater stress on compromised joints. Blocking nerve growth factor may alter normal repair processes. The body's response to joint damage may shift in ways we don't fully understand yet. Together, these effects could accelerate joint deterioration in susceptible patients. A note on imaging. In some of these cases, the changes are dramatic enough to be obvious on X-rays. However, imaging has its limits. It provides useful information, but it doesn't always reflect the full clinical picture. It's just one piece of the puzzle when assessing joint health. Why this matters? Pain control is important, but it's not the same as disease control. A dog that appears more active and comfortable may still be experiencing worsening joint pathology beneath the surface. What should be done differently? This study reinforces a more cautious and structured approach. Obtain baseline imaging before starting treatment. Repeat imaging periodically. Pay close attention to subtle changes in gait or stiffness. Reassess if the medication's effectiveness declines. Early detection is key. There's a broader context worth considering. This same category of drugs was previously explored in human medicine, but ultimately withdrawn due to similar joint safety concerns. Seeing comparable patterns even infrequently in veterinary patients should prompt careful reflection. At minimum, these medications deserve more cautious use. At most, we may need to reconsider their role altogether, because the goal isn't just short-term comfort. It's preserving long-term joint function and quality of life. And importantly, these drugs must never be used as end-of-life drug.